basic veterinary care. And so we provide spays and neuters, vaccinations, ears, diarrhea, vomiting, inappetence, anything that we can do with minimal diagnostics from mobile units or our stationary hospital. We do have the resources of our 92nd Street Upper East Side Manhattan Hospital as well for diagnostics, but we primarily do primary care visits. That should explain it all. What does your day-to-day consist of? Great question. So recently I switched to primary surgery before the pandemic began. And so I do about 40 surgeries a day, any composition of dogs and cats, females and males. And then I do everything from beginning to end for recovery. And then 20% of my time is spent doing appointments like I discussed. Now, since the pandemic started, we have gotten more diagnostics on our limited facilities because we have to provide emergency services. Our clients aren't able to go to other places to pay full price, and a lot of the lower cost options in New York that had been available to them are not now. And so we are providing everything. So we're doing blood work from the truck, we're doing urinalysis from the truck, and then we're sending anything that absolutely needs radiographs or further diagnostics to our hospital. But I've been seeing nothing but emergencies every day, 4 days a week for the past few months. So yes, that's what I've been doing. That's my day-to-day. If you have a more specific question about any of those things, please let me know.
And Dr. Ball, how long are your days usually?
Yeah, so primarily the ASPCA does 5 days a week, 8 hours a day. However, spay neuter surgery is awesome because the second you're done with your surgeries and your patients are recovered, you can leave. So if I can do 40 surgeries in 4 hours, then my day is, 5 hours, all things considered. So that's great. Right now we're doing 10-hour, 4 days a week, all emergency. So can you see my enthusiasm about emergency visits? Yes. So, no, it's great though. My clientele is wonderful. I love it because it's incredibly diverse. So that's wonderful. Do you have a surge of stuff? I'm sorry. Let's see how to work this.
Oh,
Tara,
I can read it to you. Do you have a surge of spays/neuters during kitten season? Maybe like
yes, absolutely. So our hospital is in Glendale, Queens, and we see the most spays and neuters of feral cats in the city. So we do upwards, I think New York total, we do about 80,000 spays and neuters a year. And so most of those are cats and most of those are female cats, and we do see a surge during kitten season. So I've gotten to see both sides of that because I've done a many of controversial pregnant spay. Unfortunately, that's a big thing. But I've also worked in the kitten nursery recently, so I see both sides of it. The kitten nursery, we essentially try to decrease the mortality rate of kittens, neonatal kittens, and queens, because obviously living out in the elements is pretty high. And so we take them as early as 1 day old, and we keep them until about 8 weeks. And then we set up with our adoption center to have them placed into homes. Even though they are born out on the streets, they don't necessarily have to stay feral. So we try our very best to socialize them with our behavior department to get them placed into homes. And they do really well.
That's awesome.
I saw another question. I couldn't read it quick enough.
Yeah, there is another question. So it says, did you do any internships or residencies after graduation?
Excellent question. So I did not. I did a ton of externing, but no internship or residency. I was a little bit preoccupied with paying bills, and so I couldn't take the hit for payments. But I do recommend it. The ASPCA actually has an internship program for shelter medicine and spay neuter. There's also a lot of resources that, although they're not an internship proper, you can rotate through the different departments. And we have something called Spay Neuter Alliance in North Carolina in Asheville, where you essentially get thrown right into the trenches and learn a bunch of spay neuter techniques that you can use in shelter medicine. So I worked with the Richmond SPCA, I've rotated through the ASPCA here in New York, and then I've done Spay Neuter Alliance for my training.
Very cool, very cool.
And to the people in the room, are you guys interested in shelter medicine specifically? And do you think that your schools are providing adequate education in that area? free to unmute too. I don't want you to feel like you can't talk.
Yeah, if you guys can't unmute, just wave at me. Are you guys able to unmute yourselves?
Yeah.
Okay.
I'm
Perfect.
keeping my options open, but I'm really interested in like working with big cats. So that's why I'm like asking you, like just kind of step up, asking you into more information about it, because I just don't want to work with like specifically domestic cats, but like big cats as well.
Yeah, definitely. So I actually worked with the Virginia Zoo for a while, and obviously they have a bunch of big cats. It was a really great experience. I think cats are cats to some extent because they are all very, very similar. Learning some of those like behavioral things, I would really put an emphasis on that if that's your goal to work with big cats. There's so much feline behavior research being done right now. Even though a lot of it is obviously focused on domestic cats, I would give that a try. Also, there is a scholarship program through the Animal Behavior Society, and I don't remember what it's called, but you'll have no issue finding it. It's for students who are doing research on animal behavior, but they have a lot of resources, and it's specifically for diverse students to apply to. So if that's something you want to go, it would be great for even just networking, even if you don't necessarily have research that you're doing yourself. But in the future, just consider that too, okay? Help me out, Tiara.
Yeah, so I think that she's like, help me out. It's okay. I know that people are probably thinking of questions. And you know, if you have one and you don't think that it's important, I'm sure that someone else has it and is also thinking the same thing. So both of you guys are not writing it. So someone just go ahead and pull the trigger on that. But Dr. Ball also was wondering, oh, Kennedy, did you want to talk?
I got you. But so my random question is, like, I know some people like try to do like the backyard flock thing in the city. I'm into food animal, but I also like small animals. So I'm doing food animal, but I like mixed. But like you have, like if they were like, hey, I have this chicken, you can help with that.
Unfortunately, through my job and the capacity we have right now, we don't work with them. You're very right. There's a lot of flocks, especially in the Bronx. I actually had a client who runs an Instagram page for her backyard chicken situation in the Bronx. And we have a location that actually has 2 roosters that kind of walk around the neighborhood, and they are. But what we do in the capacity through the ASPCA is we actually have a humane law enforcement department that was dissolved, but it's now called community engagement. And what we do is we help with cockfighting situations, and that's a big thing in New York. And so we don't necessarily work with them directly through our primary care departments, but through community engagement, we set up resources to have them go wherever they need to go to be safely rehomed or treated, and then to obviously dissolve and investigate these different cockfighting rings.
Nice.
Yeah, that's really cool. So something that Brianna brought up that I think is super important is a lot of people don't necessarily think of shelter medicine or even spay neuter surgery as a viable like first choice, and I didn't either, so I'm not offended in the least. But I will say for people who are interested in a certain type of quality of life, it really does give you some options. So if you know that you want, you know, good hours, you know, great pay. I don't think a lot of people think shelter medicine is a great option for good pay, but it really is. There's also the public service loan forgiveness program for student loans. If you go into shelter medicine for 10 years, which is not hard because they don't have to be consecutive years. They don't have to be through the same location, so you can switch jobs at any point. And it doesn't even have to necessarily be a veterinary nonprofit. That's just what I'm emphasizing because obviously what we're here for. But yeah, so if you do that for 10 years, then they help you pay off your loans, and you don't have to do the same thing with the traditional repayment where you pay the taxes on it at the end. They just pay off the rest. So you can do income-driven repayment, work for a nice job with good hours. And honestly, I feel like I'm doing a really good service to the community. So I think it's a really nice job as far as veterinary medicine goes. We talk about burnout in private practice. I'm doing everything that I do in my private practice jobs, except I get to give it to people of color for free who need it. And it makes me feel really good at the end of the day, you know? So.
For sure. That's exactly why I was excited to go into shelter med with the ASPCA.
Yeah.
with Dr. Ball as a huge inspiration, and motivating factor for that. But I think it's pretty cool to be able to give people the option to provide their pets with healthcare, if they, even though they maybe cannot afford it.
And
So
it brings up such a good connection between human healthcare and animal healthcare, because obviously we notice that there's huge wealth disparities and health disparities that go along with it. And that stuff trickles on down to the animals too. And so it's just really nice to be able to use kind of my public health background and shelter medicine to tie it all together to just increase awareness and information and just communication in the communities that I love,
Yeah, for sure. And Dr. Ball also has an MPH. I'm not sure if you guys saw that or not, or she trained a lot for an MPH, so she has all of that knowledge. I know that you asked about, whether people were getting exposure into shelter med at their schools. And so I didn't know if people wanted to comment on that or not. Does your school talk about shelter med? Do they expose you guys to it? Do they let you know what it is and what it isn't? I don't know if anyone wants to speak on that. I know some of you all are maybe just going into your first year, so you might not know, but for anybody that's in the trenches, first, second year, do you have anything to say about that?
Well, at Tuskegee, we have a shelter medicine club, so
Excellent.
that's available for people who are interested in shelter medicine. But I feel like it's more like on the volunteering side, like going and actually volunteering and then like fostering animals. So if we did want that experience, because I actually did have a question. My question was, I know that you said that you would recommend like an internship or an externship like for the experience before going into shelter medicine, but do you feel like there are a lot of opportunities for students just coming straight out of vet school to work in shelter medicine, like as a first start?
Oh, excellent question. Yeah, no, definitely. I think when I say I encourage people to do an internship, that's if that's what you want to do. There's plenty of opportunities without one, especially in shelter medicine. It's a very learn on your feet type of area. But you have the skills when you leave veterinary school to go into this type of work. I just think it's nice sometimes to have the additional training. That's why I gave you a couple options of different things that aren't internships, but they're externships that I think you could pursue. I'm glad you guys have a program at Tuskegee to kind of work with that. And I know what you mean about volunteering. So sometimes they kind of put you in those shelter roles where you're just kind of cleaning up, and that's not really what you're looking for veterinary experience. So something that you could do is you can see if the shelters around you have resources for fear-free training, and you can say, hey, if I volunteer with this practice, could I work under your account for fear-free training, because they have access to those things. So that's one way you can use those opportunities wisely. Also, with the shelters, a lot of times there's one vet, there's a bunch of techs, and there's a bunch of assistants and like kennel hands. And the vets are pretty much doing everything, and they need a lot of help. So although they might have you doing a couple of kennel type of things, it's really nice because you can get one-on-one access to the vet, and they are in charge of everything. So it's literally learning like herd health. So even if you don't necessarily work with them, just talking to those vets, you can learn a lot. So I would just take those opportunities as maybe schedule a time to talk to them about it. And then the more you get in with them, the more they might let you do. I found that my shelter externships were some of the ones that they gave me the most hands-on experience. I just kind of had to show them I was dedicated to it, Does that answer your question?
No, yeah, that definitely answers my question.
Perfect. Okay. Let me know if it doesn't. I ramble. All righty, guys. What else we got? So I guess raise your hands. I can see the little raised hands. If you guys have a shelter program at your school, I'm so interested. Oh, geez. So none of you do. Oh, wait. Oh, yes. Hi. Thank you, Tiara.
I don't really know how to raise my hand because I'm the host.
I don't know how to like do the little raise hand thing.
Yeah.
Gotcha. Okay, perfect.
So Brianna says she does. Kennedy, I don't know if she said something. Kristen?
Working on it. I don't know for NC State, but I know for A&T we're doing a program where undergrad kids, so they do like a dog walking program, but then they also get vet hours by shadowing the vets at their local like animal shelter.
Amazing. I love it. Okay, perfect. I love those programs, honestly. There's so many options for how you can help people with those types of dog walking programs. I love that. We have one for our elderly. So another area that I think is super important is I talked a little bit about public health, but something that I do on the side and something I do through the ASPCA as well is I go into elderly communities and even talk to students sometimes about different primary sources of veterinary care and resources that are available to them. And I think that's really, really helpful. So a huge part of general practice, and I'm speaking mostly from a small animal background, but in any area of veterinary medicine, it's so important to educate your clients. And you guys have the tools to do that when you leave veterinary school. And so something that I love through Shelter Med is I get to work with these programs, like I said, going into elderly communities and just explaining to them very basic things. When you're in a 15-minute appointment, 15 minutes back to back for 8 hours, like sometimes things are lost in translation. You think, hey, I explained that really well. And then they walk away and come back 8 weeks later with the same question. And so one area that I think is really great with shelter medicine is gives you a lot of opportunity to talk to people and kind of explain what you want them to know about basic care. And then they disseminate that information into their community, right? So we talk to them about herd health. We talk about worms. There's a huge thing in New York. I didn't realize in the Latino community where they have a lot more issues with intestinal parasites. And so they come to me and they're always wanting to deworm their adult dogs. So we know that adult dogs generally don't get worms, right? And so that's a great opportunity for me to kind of debunk that myth in our community here and kind of give them better information about how they can do preventative care. And so I don't know, it's just a really good opportunity for that. So if you guys do have a chance to volunteer in the shelter, ask if you can speak to the clients who are coming to talk about adoption or spay neuter, and just see if you can work on those skills as well.
So I was gonna mention, like, here in Auburn, we have like our Lee County Humane Society, and then we have a Humane Society within Macon County. But like a lot of the, like, they don't have their individual veterinarian. Like they have clinics that kind of like outhouse. So there's like the program for people who make under a certain amount of money that can get their spays and neuters for like $5 and $10. And so they'll send them to a certain vet that's in the county. But currently, like, those vets, of course, they're like private practices, so they aren't really taking any like people to shadow or help out around. Like, how would you recommend going forward, and if we're interested in something like shelter medicine during this time and just onward as well?
Gotcha. No, that's a really great point you made. So there's two different things that I think you brought up that I think are really important. So you can learn something from everybody, right? So I'm sure if your shelters, your humane societies don't have a vet on staff, then they have to have a technician because someone's doing vaccinations there. So when you're a first year, second year, third year, fourth year, you're the tech, that's kind of the responsibility that falls on you. So you still have a ton that you can learn there. They know a lot about herd health. They know a lot about different drugs and different things that you're going to need to know for parasitology, that you're going to need to know for epidemiology, that you're going to need if you ever take public health. So that's a lot of the concepts you can learn from maybe the technician if there's no veterinarian. If they have partnerships, that's kind of amazing though, right? Because there's all these different vets across, it seems like, your community that's working with this shelter. So if you can get past the secretary, that's always the barrier, to ask them, say, hey, I'm affiliated or I volunteer with this shelter and you guys do spays and neuters. I know you don't traditionally take, students necessarily, but want to follow this case to fruition. People, think they have a lot of respect for that type of initiative. So I would try that angle maybe.
I've actually like worked for one of the main vets who is in charge, like the rabies vaccine, like rabies vac officer for our county. And it's not like they weren't willing to help. Like if I asked questions, they would answer them, but it kind of was a yes or no type thing. Like they weren't really willing to teach me, even though they had a good amount of workload, like a good amount of people coming in and out throughout the office. And this was before the pandemic even started. This was on like my year off in between like grad school and vet school. And it wasn't not beneficial, but I kind of felt like I was doing a lot of cleaning, a lot of tech work instead of like kennel tech work versus
For
vet tech.
sure. It is so difficult. And you bring up an excellent point because you go in there with all the best of intentions. You say, I made the effort. I asked them. I know they have, what I need. And so something that I started to do, because I would call every day for weeks at a time, and I would annoy the living crap out of them because you really have to get past that secretary sometimes. But the other thing that I did that I think was more effective is I went ahead and found an internship. I did about 200 hours at this internship up in Massachusetts, and I came back with a list in my hand of every single technique that I had learned. And I said, hey, I am really looking for in-clinic experience. This is a list of things that I'm willing to bring to your practice, besides just kennel work, besides just, walking the dogs or whatever the case may be. Like, I can do venipuncture, I can restrain, I'm fear-free certified, I can clean ears, clip nails, I mean, everything, because it just shows what you can bring for them. I think a lot of people are just busy. I don't necessarily think they mean it to be like throwing shade and like, oh, I don't want to help the next generation. I think a lot of it is just they're very, very busy. So they're like, well, what can you do for me? The other thing you can do is instead of initially just jumping in and saying, hey, can I make some commitment to coming here several hours a week? You could give them the option to say, can I schedule an appointment during your office time to basically sit with you and just discuss what you do? And it shows just a different angle, because they're going to get so inundated with students who want their help, especially because it sounds like in your area there's not a lot of shelter opportunities, or at least veterinarians that are very much in the forefront. So kind of creating a space to say, hey, I respect your time and this is what I can bring to you, or this is what I'm asking for you, and it's a very set amount of time, if that makes sense. She's frozen.
Oh, she is frozen.
Blink twice if you need help.
That's so funny. I think that's a pretty good answer to that question. Oh, it looks like maybe she got kicked off or disconnected or something.
Oh, poor thing. I hope she was able to hear everything. Yeah, sometimes you just have to get creative. There's so many vet students, so many vet students, and so many people who want to be vet students that won't go there, right? So like you have to think of all those people that you're competing against to try to get someone's attention. And sometimes you just got to be creative. Like, what can I bring to your table so that you will want me to be around you, basically.
Right.
Another thing, so if we're just going to get on an experience tip, because that's so important, look into really creative opportunities. So I always used to say shelters is creative, but of course, if they don't have a vet, you got to move on. So you're just looking into different options. So aquariums, people always forget about those. Zoos, stranding teams, wildlife centers, animal care and control. Those are all animal experiences that I think could be really beneficial to you.
Definitely. Brianna, were you able to hear Dr. Ball's response to your question? I think you were frozen and then got disconnected.
Yeah, my Wi-Fi is just really unstable over here. I heard a good amount of it before it cut me off.
Okay. Well, that's totally fine. And we're recording and you're a member of our community. So if you want to catch the last part of it, it'll be like on the members pages. So that's perfect.
But also, if you guys want some help with how to kind of come up with some different angles, because that's something I focused a lot on before vet school, I'd be happy to like brainstorm with you for your area. So just let me know. I'm sure my email is posted somewhere and I'd be happy to give it again if you need it.
For sure. Well, if that's everyone's questions, let me turn my video back on. If that's, all the questions that you guys have, Dr. Ball, we won't hold you, for the entire afternoon. But thank you so much for being with us and hopping in for a breakout session. We really appreciate it.
For sure. Thank you so much for having me, as always. And good luck to everybody, vet students. You got it.
All right. Thanks, guys. See you all later. Bye.